Welcome to our presentation. Today we will be discussing the legalities of telehealth. What is telehealth? Telehealth allows for the delivery of healthcare, education, and information to the patients who are at a distance from basic healthcare. Telehealth includes a collection of integrated technologies designed to allow for the increase of contact between the patient and medical professionals. Telehealth is designed for the use of multiple sectors, including home care, dentistry, counseling, disaster management, etc. Additional professionals can consult on a case along with connecting with patients at home and saving expense and travel for both the patient and the professional. This tool is designed to assist medical staff in devising a population health strategy, making data accessible and actionable to multiple points of care, and supporting patients as best as possible. There are four major forms of telehealth, which include real-time communication, store and forward, remote patient monitoring, and mobile health. Real-time telehealth allows a patient and their caregiver team to connect via audio and video. Additionally, telehealth allows medical staff and a patient in an exam room to connect to an interpreter. Store and forward allows medical staff to send digital images for the purpose of diagnosis. An example includes radiology. Telehealth utilizes health information technology as a medium to provide this care. Electronic health records, or EHRs, can contain a telehealth component but are not telehealth as is. Remote patient monitoring allows providers to connect health and medical data from their patients and have it transmitted to them electronically for the purpose of care. This portion of technology allows care teams to stay connected to patients post-discharge to reduce counts of readmission. Lastly, mobile health, or mHealth, allows for the use of mobile technologies in healthcare settings, including tablets, cell phones, and PDAs. Methods range from targeted text messages to alerts about disease outbreaks. Telehealth allows patients to be more autonomous about their care. He or she can understand his or her condition better and take better control of it. The provider can be better a part of their patient's well-being via proactivity. Telehealth also expands access to care through outreach to patients in rural areas and outside of the care system, provider education, and provides telemedicine care. Additionally, telehealth improves clinical workflows since the technology allows physicians to gather the patient's reason for inquiry, prioritize the patient, diagnose, and treat the patient. Lastly, communication is improved from the patient to the provider. EHR companies such as Meditech are integrating telehealth software as a portion of their home care division or other appropriate division. This integration includes marketing telehealth in campaigns such as Care That Spans a Lifetime. With healthcare organizations facing an increasing demand to manage their chronically ill and critically ill patients, telehealth allows patients to manage multiple chronic illnesses and meeting the demands of intense coordination of care on a daily basis. Telehealth allows the care team and patient to focus on disease management strategy while maintaining safe and quality care. EHR companies use integrations to smartphones to capture data including vital signs such as blood pressure, heart rate, etc. This data flows to the EHR and can alert care teams if there is a potential issue. Organizations that have adopted telehealth solutions from EHR companies such as Citizens Memorial Hospital / Citizens Memorial Healthcare Foundation have found a decrease in their readmission rates and have increased savings. For patients overwhelmed by their illnesses or not adhering to their discharge instructions and medication usage, telehealth has allowed the organization to keep their patients healthy. By monitoring their patients on a regular basis with telehealth, the medical staff has been able to deduce when there is a variation in health status or a potential issue. This monitoring has prevented unnecessary ED visits and readmissions. Additionally, their nurses have not had to travel as far in rural Missouri, which has saved dollars and time. Ultimately, providers are most driven to telehealth due to the consumer demand and better patient outcomes, and are primarily using the patient engagement and patient monitoring portions. However, telehealth has been defined differently in policy in various states. With varying definitions of policies and regulations, this varies how telehealth can be used. Keeping this in mind, throughout this discussion, Team 2 seeks to understand the various legal nuances surrounding telehealth and models for improvement. First, we'll explore the regulations surrounding this technology. Next, we'll establish the legal nuances, including answering questions such as, are the varying laws reasonable and what are the standards of care? Last, we will establish resolutions to improve telehealth. Ultimately, we seek to analyze the legalities of this technology to further help the industry improve patient outcomes, overall care, and cost-saving measures.
When it comes to state laws in regards to regulations for telehealth, the Center for Connected Health Policy has tried to stay abreast of the changes in each and every state, and they've released 4 editions up to this time of state telehealth laws and reimbursement policies. This is an actual document that is released in the spring of every year, and it's a comprehensive list of state definitions, laws, and regulations. However, due to the time delay from a yearly release, there is some outdated data every year. So they have a website that is listed below, the telehealthpolicy.us website, that is updated regularly with every state's laws, regulations, and definitions. Specific to Connecticut state law, there are 11 laws that the Center for Connected Health Policy covers, as well as the definition. So Connecticut has defined telemedicine as meaning that the use of interactive audio, interactive video, or interactive data communication in the delivery of medical advice, diagnosis, care, or treatment. Telemedicine does not include the use of fax or audio-only telephone, and the statutes are listed on every slide. They've defined telehealth as the mode of delivering health care or other health services via information and communication technologies to facilitate the diagnosis, consultation, and treatment, education, care management, and self-management of a patient's physician and mental health, and includes interaction between the patient at the originating site and the health provider at a distant site, and B, the synchronous interactions, asynchronous store and forward transfers, or remote patient monitoring. Telehealth does not include, again, the use of fax, audio-only telephone, texting, or electronic mail. Connecticut state law regarding live video reimbursement is that the Medicaid is required within available state and federal resources, of course, to provide coverage for healthcare services for categories of healthcare services that the Commissioner determines are clinically appropriate to be provided through telehealth, cost-effective for the state, and likely to expand access to services for whom accessing healthcare poses an undue hardship, and reimbursement for services provided via live video. Connecticut state law regarding store and forward reimbursement is that reimbursement for services provided via store and forward, and it advises you to see the private payer section. Regarding email, phone, and fax, as it stated previously in the definitions, is that there is no reimbursement for telephone or fax. State law for online prescribing is that no telehealth provider shall prescribe schedules 1, 2, or 3 controlled substances through the use of telehealth. And Connecticut state law regarding consent in regards to telehealth is that at the time of telehealth interaction, the provider shall provide information to the patient, treatment information, limitations of the telehealth platform, and obtain consent from the patient to provide telehealth services and disclose to the patient's primary care provider records of the telehealth interaction. Connecticut state law regarding cross-state licensure. The Department of Public Health may establish a process of accepting an applicant's license from another state and may issue that applicant a license to practice medicine in the state without examination if certain conditions are met. And last and not least, Connecticut state law regarding private payers. Each individual health insurance policy and group health insurance policy providing coverage of the type specified in subdivisions 1, 2, 4, 11, and 12 of sections 38A 469 shall provide coverage for treatment provided via telehealth if that it was covered if provided in person and shall be subject to the same terms and conditions of the policy. We're going to touch on this in just a couple of slides regarding parity. So Interstate Medical Licensure Compact. So the Federation of State Medical Boards is a nonprofit organization that represents medical and osteopathic boards across the nation. It's actually voluntary. They will represent you voluntarily, and you can become licensed through them on a voluntary basis. There's currently 17 participating states. The goal is for it to become a nationwide participation. It's federally regulated, but it's again governed by the states. So an example of this would be if there was an issue with a state medical board and a physician's license, they could revoke a license on a state level without having to go through the federal regulations. Connecticut is not a participating state with the Interstate Medical Licensure Compact. And parity laws. As I touched on just a little bit before, so parity laws essentially is talking about equal pay and reimbursement when it comes to telehealth in regards to the same pay and reimbursement for in-person diagnoses, treatments, and examples like that. So parity laws are necessary for telehealth to be sustainable. Telehealth cannot be reimbursed at a fraction of the cost of real consultation medical care. Currently, reimbursement for Medicaid is left up to the states to negotiate, and as we were talking about earlier, with that being the case and the fact that there's no parity laws in place for that, Medicaid can be reimbursed, at a percentage here in Connecticut and a different percentage in Massachusetts, etc. And the same goes for third-party payers. There's currently reimbursement laws for 32 states for third-party payers. However, they're inconsistent. And they're not, just because there's a law doesn't mean that they have to be reimbursed at the same rate as in-person medical care.
The potential for fraud and abuse is a concern for healthcare providers, as they often find themselves under tremendous scrutiny in their home states. With the additional layer of a telemedicine platform, new concerns for fraud and abuse come to the forefront. In fact, the RAND Corporation estimates that of the $1 trillion spent on Medicare and Medicaid, approximately 10%, near $100 billion of spending occurs due to fraud and efforts to combat it. As seen in our discussion, the legal and regulatory demands in order to grow the telehealth space can be quite daunting, and with expansion comes a new series of issues for healthcare. The potential for fraud and abuse must be considered when further legislation is enacted. And current legislations obviously hold true, but the administrative burden on healthcare organizations and governments, and as well as government bodies, remain quite daunting. With the expansion of healthcare, there has been a concern regarding Stark Law, which is one of the federal anti-kickback laws that we are aware of. As per this law, physicians that have ownership or any financial investment in any entity may not refer Medicaid or Medicare patients to that entity. As a result, the physician may suffer civil monetary penalties if this is violated. Adding a telemedicine platform could make it more challenging to discover abuse and could potentially entice more physicians to partake in such unethical practices. Another concern or potential for abuse arises from the anti-kickback statutes, where a physician may not be compensated in an effort to induce referrals to an entity that bills Medicare, Medicaid, or any other federally funded program. This statute is harder to prove, but on a national level with telemedicine could become even more challenging. In an effort to curb such difficulty, the Affordable Care Act did away with the requirement that they prove willful intent on the part of the defendant to violate the statute. Now, all that needs to be shown is that the defendant knowingly or unknowingly violated these laws. There is also the concern that physicians may bill for services that were never rendered. This is already a concern as Medicare seeks to reclaim many fraudulent claims. The amount of resources expended on convicting is tremendous, but placed in a virtual realm would require greater expenditure of resources and add to the ballooning cost of fighting fraudulent claims. The opioid and anxiolytic epidemic has claimed the lives of many people, and this has led states to adopt measures to protect its citizens with education and also pass legislation such as having EMTs carry naloxone, the antidote for opioid overdose. This crisis has also compelled many states to start registries where every time a patient fills a prescription for painkillers or anti-anxiety medications like Xanax, this goes into a central database that doctors can review for suspicious behaviors. This has placed the onus on healthcare providers to better police their prescription behaviors. In the telemedicine space, the Ryan Haight Online Pharmacy Consumer Protection Act of 2008 was designed to ensure that any controlled substance dispensed over the internet would require a valid prescription as well as an in-person medical examination to ensure appropriateness. Again, at the state and local level, this is quite difficult to manage. But if this scheme could be transformed on the national level, the logistical policing of this for healthcare providers and even the Drug Enforcement Agency could be quite challenging. The credentialing and privileging process for hospitals necessitates that hospitals go through the due diligence of ensuring that the healthcare providers are able to practice. In a landmark case that we learned about of Darling versus Charleston Community Memorial Hospital, the Illinois Supreme Court established that a hospital could be held liable for corporate negligence if they did not properly vet their medical staff. Now, on the other side, one of the draws of telemedicine is to be able to bring clinical expertise from larger academic institutions to smaller, more rural hospitals. The process of credentialing and privileging may deter physicians from expanding their reach of practice and may also deter smaller hospitals from credentialing doctors from distant site hospitals. As a means to streamline the process, hospitals receiving distant site services may actually rely on that distant hospital for its credentialing process to ensure proper due diligence was performed. Essentially, the academic medical center's credentialing would be considered sufficient for the smaller hospital to utilize. This was outlined in an update to the Centers for Medicare and Medicaid Services Conditions of Participation ruling.
When a patient is receiving care from a physician via a telehealth appointment, the physician's abilities are somewhat limited. They can't listen to respiratory sounds or feel for tender areas, can't see inside the ear or draw blood. Because of the limited visual examination, the patient may require local face to face follow up for an appropriate diagnosis. This may lead some to believe that the telemedicine interaction does not constitute establishment of a provider patient relationship. However, that is incorrect. According to Posgar and Santucci, a duty to care can arise from a simple telephone conversation, and according to the American College of Physicians, a valid provider patient relationship must be established for a professionally responsible telemedicine service to even take place at all. In an American College of Physicians position paper, Daniel and Solmesi state that physicians using telemedicine should ensure that they are adhering to all privacy laws, as they would if they were seeing patients in person, and adhere to the same level of professionalism. So, this means that they would not be providing care to a patient who is in a public place or allowing other behaviors that would be considered unacceptable if the visit were taking place in person. Certain sensitive diagnoses require even further protection, such as behavioral health and substance abuse disorders, STDs or STIs, and other delicate topics. Federal laws such as HIPAA and high tech are intended to protect patients against the sharing of patient information and sensitive data. However, hackers do manage to invade data at various organizations, which is illegal and punishable by law. Appropriate steps need to be taken by providers to secure networks and properly destroy paper documentation to prevent such breaches. This protects against intentional misconduct, though not simple human error, which, despite being accidental, is also unlawful and punishable. Just like cybersecurity, the standard of care or conduct expected of a telemedicine practitioner is that telemedicine be held to the same standards of practice as if the physician were seeing the patient in person. This is according to the American College of Physicians. In situations where the telemedicine provider has had no previous face to face contact with the patient, they must take the appropriate steps to establish a relationship. The standard of care is based on what would occur during a typical in person visit, unless the provider is a teleconsultant who is providing education to the physician who already has a relationship with the patient and is therefore primarily responsible for overseeing their care. It's critical for a physician to be proactive in understanding the risks and key considerations surrounding telehealth liability and to protect against medical malpractice. Areas of potential liability include quality of the care provided, quality of technology and security, privacy and confidentiality breaches, the state in which care is received and rendered, and appropriate training and licensure for the provider who's offering the telemedicine services. Telemedicine providers also need to be cognizant of the state and federal regulations and legislation pertaining to telemedicine in every state for which the provider is licensed and providing care to patients. It's also important that the physician obtain liability insurance that covers the provision of telemedicine in each state for which care will be delivered.
Some ways to improve telehealth would be to create local stations so that patients can chat remotely with physicians. Other ways to improve it would be to increase the buy in from patients, and by doing that, you would need to educate and train on how to use telehealth. Also, express the convenience of it compared to the alternate. Also, you'd have to inform them of the growth potential of the field.
The younger generation of patients and everyone thereafter will be utilizing telehealth practices more frequently because they grew up with and feel comfortable using technology. Although this covers a wide range of patients, we still need to accommodate the needs of the older generations. Having local stations that people can go to so that they can video conference with physicians is one solution. But older telehealth users will also need education and training to utilize telehealth to its full potential. This can be done by having employees at the local stations to help guide those who are not familiar with telehealth and answer any questions right away. Patients who choose to remain at home while using telehealth practices could call a support telephone line when they are confused, but it remains difficult to orient older generations to objects on the computer screen through speaking alone. Since more than 77% of Americans over the age of 65 say they need help using technology, a hands-on training program for those who choose to use telehealth should be provided. Programs such as the Older Adults Technology Services, otherwise known as OATS, help older generations learn more about technology, but many of these services lack funding and volunteers. A training provided through telehealth services would help increase patient comfort levels in older generations and therefore increase the use of telehealth practices.
Other things we need to focus on with telehealth is protecting patient data. This is important because the more safety with telehealth will lead to more use by patients. Preventing hacks and patient data is imperative in telehealth's future. Another way to improve telehealth is to increase where it reaches by the global benefits it can have. First, we would have to change laws that could allow physicians to practice in all areas, not just the states in which they live. This would bring telehealth to the global field and would help decrease sickness and death in countries that do not have appropriate systems.
For telehealth to become a more widespread and accepted practice, government regulations and laws might have to be adjusted to fit with the accelerated technology and changes that the service will bring. For example, regulations prevent physicians from practicing medicine and prescribing medicine over wide geographic areas and across state lines. Since one of the purposes of telehealth is to expand the number of physicians available to a patient at any given time, these regulations will need to be adjusted so that a patient needing assistance in one part of the country could receive feedback from an available doctor on the other side of the country without legal repercussions. To supplement the suggestion of the reevaluation of laws and regulations to increase the accessibility of telehealth, there has been a recent legal battle between the federal government and a physician in Texas about the prescription of drugs using telemedicine without ever seeing a patient face to face. According to the Ryan-Haidt Act, a prescription for a controlled substance may not be dispensed over the internet without at least one face-to-face medical evaluation. The reevaluation of this law as telehealth becomes more popular and online medical evaluations become more widely accepted could help improve the presence of telehealth nationally and globally. Allowing patients who are restricted to certain geographic areas or have restricted mobility to receive medication with no face-to-face evaluation could be a major step for the future of telehealth.
Another area that needs to be improved with telehealth is the area of reimbursement. In order for telehealth to be beneficial and lasting, we need to focus on the reimbursement process and revise or make new laws that allow for telehealth to be used at its full potential.
Despite the benefits, telemedicine has been slow to adoption, and having alternative avenues to treat patients has given healthcare providers improved access to evaluation and treatment. Digital medicine is in its infancy and will require additional research, funding, and education. If proper measures are taken to improve and expand it, telemedicine has the opportunity to make a tremendous impact on everyone. Telehealth is one way to bring additional choice and resources along with creating a more consumer, patient-centric medium for care. As Don Berwick, MD, a former CMS administrator, said, "If you don't think healthcare is about power, you haven't been paying attention." With federal funding and policy, appropriate state legislation, and educated providers, digital medicine has the opportunity to continue to make a tremendous impact on the world. And although the future of telehealth is bright, the changes that are necessary to help it reach its full potential are daunting. The funding to create local stations, pay employees, provide education, reward physicians for supporting telehealth, maintaining patient safety measures will not be easy to acquire. Years may go by before changes to laws and regulations occur. Even the most protected information never can be completely safe from expert hackers. As telehealth continues to grow and develop, we believe the product could successfully change healthcare and administration of care to our fellow patients. This will ensure that we move closer towards greater value of care and volume. Thank you. We hope you enjoyed our presentation.